Hey, howdy, Jeff Moody, MD here for jeffmoody.com, jeffmoodymd.com, and Burnout Recovery for You. What I would love to talk to you today in today's weekly video burnout breakthrough video tip, what I'd love to talk to you about is that sometimes there's a question about burnout, about whose fault is it? Okay, there's been a lot of debate in the burnout therapy community about what we should even call burnout. That it's not, burnout is maybe not the right term, maybe it's actually moral injury, maybe it's human rights violation. To a certain extent, I'm not sure I care what it's called. I just want it to get looked at, get diagnosed, get treated, get better, and change the personal factors that need and want to be changed, and change also the systemic factors that I think realistically are about 80 to 90% of the factors that drive burnout are systemic factors that are not necessarily in our control directly, but are critical for us to get those changed and moving in the right direction. When I do talks, I will survey the audience. I'll say, what percentage of people are burned out because they have to see patients or do surgery? Maybe 5% of physicians say that. When I ask how many people are burned out because of an electronic medical record, I think if we could, it would be 200%, but it's routinely close to 100% of physicians are burned out because of electronic medical records. So for sure, I never ever want to be a person who would blame the physician themselves. I think our only area of blame, perhaps, is that we have gotten used to just accepting the status quo. I think we need to advocate for ourselves and move towards making changes, either in yourself, but more importantly, in conjunction with systemic changes in your call schedule, in your call pay, in your call coverage, in your electronic medical record, in the duties that are required by your system, in the compensation structure and the way it works within your group or your healthcare system for yourself. I feel very strongly that the physician is the last person to be someone who is to be a blame in this scenario, but I would hope that by working towards both personal and systemic changes and improvements, you will no longer have to worry about who's to blame, because you will be better and recover from burnout. So, if you like these video tips, please go to jeffmoody.com, sign up for my email list, make sure you don't miss any, sign up for our live stream at Jeff Moody MD on YouTube, find me on Facebook at Jeff Moody MD, and on LinkedIn, Jeff Moody. I'm everywhere as a Jeff Moody, I guess. You can check out our book, my book, The Doctor is Burned Out, A Physician's Guide to Recovery, and our course, which is really a way to turbocharge your recovery from burnout, called Burnout Recovery for You. You can also check that out at our website, jeffmoody.com. Thanks so much, and remember, burnout recovery is for you.